Good morning and welcome to Super Healthy Super Mornings with Dr. Shilpi. Today's topic is not very well discussed everywhere, but yes, it's quite personal and it's about your choice and it's about the pregnant woman's choice that has to reflect in today's topic that we're going to discuss. And it is all about the birth plan. And now pregnancy is all about choices, and women are nowadays taking their own decisions in terms of when to have a child, how to have a child, what is the plan, how to execute the plan, and how to be prepared to take care of this responsibility, and all these things. And when such a thing comes in, it's her right, and along with her partner and the family, to decide about the D-Day. And when we have to decide about the D-Day, it's about the birth plan. And I always suggest that, whenever in the OPD, pregnant women come and ask what I should do, what arrangements I should do for the delivery. I always tell them that, packing clothes and having a choice and when to do, what to do, how to do, what to eat, all these things are definitely there. But such elaborate discussions can really not happen over the chamber. And that's why I wanted to make this video about the birth plan. Now, when it comes about the birth plan, you should always, the pregnant women are forgetful and they sometimes assign it to the partner, and partner also forgets in such a hush and rush manner. When the labor starts in, everybody is in a panic mode and they do not remember what actually they planned for. So I always say that it should be a written plan, and that written plan should be about communicating your wishes and your goals during labor, before labor and after labor. So have things written so that you do not forget. Have things documented so that you can show it to the doctor or the nursing staff or the labor team, so that they can execute your wishes according to your plan. Now, what every woman wants is the best birthing scenario. So best birthing scenario for her is taking care of her wishes, taking care of her choices during labor and delivery. And you have the right to check your preferences, check whatever you want, and make a big checklist of whatever that you are really looking forward for. And why you have to discuss this with your practitioner or the doctor is to check into the practicalities, feasibilities, and check the availability or whether it can be done or not. And it can be simple, it can be detailed, or it can be individualized plan. And there, initially, when I started off with Cuddles 5 years back, we in fact had a birth plan printed, and we used to ask them to fill in the birth plan. But eventually, people started not filling the birth plan, and it just went off plan. So then again, why I thought about this is maybe people are forgetting about how to enjoy their labor and delivery. It's all about the tension and frustrations that they're living in. That's why I really wanted to execute this class of having a birth plan discussion. And the birth plan basically has the basic information, the before labor, during labor, after labor kind of things, and about the medical interventions that you want, about the pain relief that you want, and what after delivery care that you really want to take. So the basic information in the birth plan is about your name, who is going to be along with you, your partner, and or whether it's your husband or friend or your mother-in-law or mother or sister who's going to take care of you during labor, and which is the hospital name you definitely have to write on it, and what is the room choice that you have. So whichever room that you've selected, you have to write the room choice, and what is the approximate due date that you're expecting, and the doctor's name. So this is the initial filling that you have to do in your birth plan. And about a few things about the before labor. So you just need to note down so that you don't miss while you're getting admitted whether you have thyroid or whether you have hypertension, diabetes, or any complications or any health factors that you really not really have to tell the doctor. And whether it is a planned delivery or it is a spontaneous delivery, or you're going to go in labor, or and all details about your birth team. Now birth team means whoever is given you the classes of antenatal classes, or the physiotherapist, or the doula, or the labor room sister. So any preferences that you have, you can check in. There are at times then we give the pregnant woman choices of somebody that they really know, and they have had their exercises done with them, wanting to come for labor and delivery. Yeah, they can come, definitely. And what is the right time and right age to plan? The right time and right age to plan pregnancy is very much variable, because nowadays it is about career and women and all that. So I just can't tell you this age is right, but whichever age is right, you have to be very spontaneous and be practical. For example, mid-20s are very good for marriages, and at least you have to complete your family before 30s. So that is very, very important. So this is possible with a good career and good planning and good execution. So this is the question that I wanted to answer. And during labor, when it comes to birth plan, what you want to eat, during labor, you have to be having a list of that, and whether you want to be in bed or walking around or climbing stairs or doing some exercises, or you want to be comfortable by yourself doing all the chores, and not just lying on bed, and whether you want water birthing, or whether you want to have some good subtle soothing music that has to be played, or you want rock music, or you want to have trance music, or you want to have incense sticks, or whether you want to have some nice candles in your labor suit. All these things are specifications, whether you want bright lights or whether you want dim lights, or whether you want photos to be taken or videos to be taken, or whether you want an exercise ball, or any specific birthing positions that you really are comfortable in, and a birthing tub that if you want, or if you want to have a warm water shower to make yourself comfortable. So all these things you can write down. So not all of them, if you want one or two, you can pick them, so that you are very, very specific in your choices and your choices are executed. Why birth plan is important? Because you are chaotic during labor and delivery. So this birth plan is going to give you some kind of an insight into what you wanted all throughout your pregnancy and what you wanted your labor to be. And any other specific things also you can keep in your list, like you want to talk over phone to somebody who's going to encourage you, or you want to have a video chat, or you want to see some inspiring videos in the room. So all these things are very specific, and you can write down and keep in your birth plan. And a word about the medical interventions. These days, pregnant women are aware of all the medical interventions, like artificial rupture of membranes to accelerate labor, whether you want it, whether you don't want it, or you want your the water bag to be intact till the last moment wherever it is possible. And about the heartbeat monitoring, some women are very apprehensive and they want to continuously see the heartbeat of the baby, whether it is good or not. Some women want it to be intermittently checked and do not disturb them. And some women do not want anything tied over for the heartbeat monitoring, so they just want a small machine to be, keep monitoring the baby whenever possible. And some women do not prefer the IV cannula itself. They say, I don't want any cannula, or I don't want any urine catheter, I don't want any enemas. Some do want it as a gesture of keeping themselves safe, and if they are constipated, they ask for an enema. And some people want IV medications to improve their contractions and finish labor as soon as possible. Some women do not prefer and want it to be as natural as possible, as normal as possible. And some women want an incision or cut to be made so that they can easily repair that cut, and delivery happens in a planned fashion. Some women do not want any cut. Even if there is a tear, I don't mind, but I don't want a cut. If there is a tear, you can repair it. And some women are very particular that they are fearful to push, so they would ask like, doctor, why don't you put forceps and deliver the baby? Why don't you put vacuum and deliver the baby? I'm okay with it. And some women say that I don't want anything, I will do it myself. And there are so many choices like this. Over a period of 9 months, you hear things, you receive things, you have that reception. Definitely you will have your own choices. So make your choices as a note what you want. And in terms of pain relief also, people have lots of choices. Some women do want epidural, some women say I do not want epidural. And some women have choices in acupressure, acupuncture, some breathing exercises, some massages, some meditation that they really want during labor to calm themselves. Some foot reflexology works, and there are so many other things. Here at Cuddles, what I do is, as a part and parcel of my practice, I take the pulse of the woman, and depending on her pulse, I take the decision forward to use this method for this woman, because I keep observing them from so many months together. At times I've seen women from last 5 years, because first child also they had with me. Now they're coming for the second child that they are delivering, or the third child that they are delivering. So I know them from so many years that I can know what their preferences can be, what comfortable, what methods they can be comfortable. I usually know. So usually I take decisions for them, and they make their big day a more memorable one. And during delivery, if anything is particular, you have to write down. Some women want to see the baby deliver, so they want a mirror so that they can see the baby crown and see the baby's head and get motivated and deliver. Some women want their husband or partner to come and deliver the baby and catch the baby as soon as the baby delivers. They want the partner to cut the umbilical cord. They want the partner to do the suction of the baby. They want the partner to handle the baby. So this is also during delivery expectations that women have. And about during cesarean section also, a birth plan works, because in the operation theater also some women want to be conscious. Yes, it's a spinal anesthesia, they can be obviously conscious. And some women say that I am dreadful, fearful, please put me under anesthesia. That is also welcome. And some women want to see the baby deliver, so they don't want any screen in front of them, so they want a screen down during the baby delivery. And one hand to be left free, so that they will catch the baby, hold the baby, breastfeed the baby, and see the baby. All these preferences you just have to write down and tell the anesthetist, tell the doctor, so that they will execute these things for you. Some people want video or recording, some people want photographs of the baby delivering during labor and delivery. It's their personal choice, and it's their day, and we have to make sure that their baby becomes very comfortable. And for the newborn care also, birth plan has lots of choices, like holding the baby immediately, breastfeeding the baby immediately, and taking consultation of the lactation consultant immediately, cord blood banking, which is actually very, very good at this point of time. Or you can save your umbilical cord stem cells for yourself and for the baby. Or if you're not willing to save, you can donate it for others also. And keep the placenta. There are people who keep the placenta to take it home. People are very particular that I will feed the baby and nothing else should be given. There are some women who are very apprehensive. They say, you give the formula to the baby, keep the baby in nursery, so that I will recover and then give. I'll take the responsibility of the baby in few hours. And there are some women that I want to keep the baby with myself, feed the baby myself, and do not use anything like a pacifier. Some women say that you can have a pacifier for the baby. Meanwhile, I will recover. And there are some women who are very particular about taking care of the baby by themselves, and keeping the baby in room with them, just next to them. That is the best choice. But there are some women who have long labors and tired and not mentally very prepared. They would ask the baby to be kept in the nursery for some time till they recover. And there are social practices like circumcision that people would want to get done to the baby as immediately as possible after delivery. That also has to be written in the birth plan. And there are preferences that vitamin K injection, immunization, how to do, when to do, but in your presence or not in your presence. All these things can be written in the birth plan. And some women want an antibiotic cream to be given to the baby just in case, to prevent infection. Some say that no antibiotics to be given to the baby whatsoever it is. And there are so many such preferences which you collect over a period of 9 months that you really want to execute. And this is the right time to what dream pregnancy that you've had, to get these things executed right in front of your eyes. So it's all about empowerment, it's all about knowing the facts, it's all about discussion, it's all about executing your choices. And this is the right method to go to labor with a plan. So this is called a birth plan. And now birth plan, people leave the birth plan to the doctor, the choices, the institutions. There are several institutions that do not have birth plans, but here at Cuddles I've always had that birth plan kind of a thing. If you have anything written, I will definitely execute. If you don't have anything written, also I will try to make things memorable for you, the best for you. But if you have your choices, definitely they'll be honored. So this is all about birth plan and how to, even a minimalistic vision to know what birth plan is and how to execute birth plan. And this is how that you should go forward. And rather than randomly asking the doctor what has to be packed and what not has to be packed, obviously this 9 months you will have your own choices, own preferences that you really have to check on and decide on the birth plan. So keep getting updated, keep knowing the facts and figures, keep empowering yourself, and keep telling your friends and sisters or relatives or cousins or whatever about the right ways of handling your pregnancy and how to have a normal vaginal delivery with confidence. So birth plan is one such an executing phenomena wherein everything is written and you need not be thinking and hunting around and answering questions in between. Everything is written and that is there, handed over, and those have to be executed. And your partner will be there for any doubts to be cleared. So this is all about birth plan, and it's another topic that I wanted to cover with passion. And tomorrow yet another important discussion we'll have. And see you until tomorrow morning, 7:30, super healthy, super mornings with Dr. Shilpi. Goodbye. And I will answer random questions also like this. About the question that somebody asked, definitely it is, if fertility rate drops and implantation rate drops after 30 years of age. So before that, if you can complete your family, you will be much in advantage. And recently I have done a video on fertility in the Cuddles group. It is available. You can just log on to the Cuddles website and see that video. It's available in Facebook also, and it is about infertility and what is everything about infertility and fertility. So bye, have a nice day. Murti garu, hello, hi.